nationwide. The total cost of the new scheme is expected to hit 210 billion Egyptian pounds annually once the entire population estimated in excess of 100 million citizens registered in the new system.
Well, to shed more light on this, we have the pleasure to have this phone with Dr. Maysa Shawky, Professor of Public Health, Cairo University. Good afternoon, Dr. Shawky.
Good afternoon, my dear, and good afternoon to all our viewers.
Thank you so much. I really have the pleasure to have this phone with you. Dr. Shawky, what is the result or the importance of the initiative by President Abdel Fattah al-Sisi for early examination for the newborn to avoid the impairment of hearing?
Well, let us first emphasize that the President is so much into the health of the 100 million civilians.
Yes.
And going through this portfolio started with the 100 million health initiative screening program, which targeted hepatitis C virus and aimed for the early detection and management of cases. And in the next phase, there was the non-communicable diseases screening program for the type 2 diabetes, hypertension, overweight, and obesity. And this was followed by a specific health screening for women, targeting breast cancer and cervical cancer as well.
Yes. So
there came at a later stage the emphasis on school children for detecting the stunted children, those suffering from anemia, parasitic infestations, and overweight and obesity. And then we went through screening for blindness or poor visual acuity, and now we are into the second special sense, which is the screening for auditory loss or for deafness.
Yes, Dr. Shawky, how does this initiative contribute to reducing the hearing diseases?
Well, let us first agree that early detection is very important for reversibility. And it is also very important because once the child is not hearing, he turns to be a deaf youth. He couldn't communicate with his mom. He couldn't communicate with the external world. He couldn't gain information. His mental development becomes so much retarded, and his speech also becomes affected. So it's a matter of the earlier, the better. And right now we have more than 2,300 screening units all over the country. We have trained doctors and nurses for this mass screening program. We have referral sites because when the child doesn't pass 2 screening tests, he is referred for a specialist, for an ENT specialist, and he receives advanced diagnostic intervention and therapy as much as possible. Otherwise, the child is declared as being handicapped auditory-wise, and he's referred for a special training program. The issue here is to prevent the deleterious consequences of the child not able to listen to sounds very early. And this is our target really, so we can prevent mental retardation and delayed educational capacity for those kids when they grow up.
Yes, so Dr. Shawky, you were just referring, saying that the impairment of hearing would result, the child would suffer from difficulties in speaking. So by this, the mother could depict or know that her child is facing problems in hearing if he's not speaking very well, isn't it?
For the mother to detect that, she needs like at least 2 or 3 months.
Yes.
However, our program here in Egypt is specifically tailored for early detection. The birth certificate has been, a certain icon has been added to the birth certificate that the child passed the screening test for hearing, and also for the medical record for children, boys and girls. We have an added icon for or column for scoring the hearing acuity of the child and whether it is fine or not. And
Yes.
the timing is very important because mothers wouldn't detect that the child is not hearing properly before maybe 2 or 3 months.
Yes. Dr. Shawky, what are the causes of the impairment of hearing for the newborns?
Well, this goes back like if the mother has taken any medications without a prescription of physician, and it could go for congenital anomalies, or it could go for infections. Infectious diseases could affect the eardrum and the hearing system. So we have several reasons for why a child wouldn't be hearing properly, and we are here to say that the reversibility is possible, and the child gaining back his hearing acuity is very possible with early intervention.
Yes. So, Dr. Shawky, how did the President's initiative contribute to raising awareness for the hearing diseases?
Well, so far as announced, we have almost 1,700 child declared to have reduced hearing power or hearing acuity, and they are referred for further treatment. And the blessing of this presidential initiative is that it included also 5,000 child from the immigrants. So it is covering children with a non-discriminative attitude, dealing with our neighbors who had immigrated because of political reasons here in Egypt to receive one and the same screening list.
So, Dr. Shawky, how do you comment on the concern of the health of citizens in light of the early detection campaigns for a number of diseases, in addition to the comprehensive health care in Egypt?
Well, I would like to tell my people here in Egypt that you are very lucky to have this kind of concern about your health, and we should take the privilege of seeking the medical screening and abiding by the instructions or by the advice they receive from the medical party, whether it is the Ministry of Health or the health insurance.
Yes. Dr. Shawky, the Health and Population Ministry of Health and Population have announced that it had conducted an audiometric survey for 2,360,303 newborns as part of President Abdel Fattah al-Sisi's initiative for the early detection of the treatment of the impairment hearing. So how do you see this?
Well, I see this as a massive act going into the difficult screening part of the story, because we have easy screening tools like measuring weight, like measuring height, like measuring waist circumferences, like measuring even the blood pressure. The more sophisticated is to measure for the type 2 diabetes, the fasting and the 2 hours postprandial, and to go into more advanced equipment for screening for auditory loss. So this means that there is a determination for having a healthy nation, and there is a determination for completeness of medical care offered to our people, and there is a much more important determination for early detection. And let me tell you that according to the WHO, the 100 Million Health Initiative screening program in Egypt is the largest worldwide.
Yes. So, Dr. Shawky, what do we expect in the near future from this initiative by President Abdel Fattah al-Sisi for the impairment hearing?
Well, the good part of the story is that those kids are receiving advanced diagnostic interventions, and they are also receiving appropriate treatment by the specialists. And if we can nullify or reduce the impaired hearing amongst our kids in the next coming generation, then this is a magnificent gift for them in the future.
Yes, I thank you so much for your time and for your valuable information, Dr. Maysa Shawky, Professor of Public Health, Cairo University. Thank you very much for joining us over the phone. Ladies and gentlemen, a short break, and I'm going to be back with you.